Peter, I think I'd like to get you to go through some hypotheticals with me. So, the first one would be, how could a provider use the principles of hospitable healthcare to, to view a patient instead of treating them, serving them?
Great question. Controversial question, by the way. And I appreciate you raising the question because we try to make that point in a responsible way in the book. And for the benefit of your listeners, let me just maybe elaborate on that. We say that one of the reasons the hospitality industry enjoys so much higher guest satisfaction and so much higher loyalty than healthcare is they have discovered that as long as you treat guests equally, you can serve them differently. An example, if you're a member of a frequency program in a hotel chain, you might go to a special counter to register so it's a shorter line. Or you might get an upgrade on your accommodations when you check in. Same is true in the airline business. Same is true in the restaurant business. So everybody's treated the same way. It's just that they have identified different cohorts of their customers that they serve differently. As a result of that, as consumers, we've come to acknowledge that that's the way of the world, right? So we say, well, why is that guy in a different line than I'm in? And the answer is, well, he has a different relationship with the provider that affords him that privilege. And I accept that. Now, in healthcare, that's kind of anathema, right? So you have that conversation with a hospital CEO or provider, and they say, well, you can't do that. And our assertion is you may not be doing that now, but you will be doing that in the future. And that is as long as you treat everyone clinically the same, everybody has the same quality of clinical intervention, there is an opportunity to serve patients differently. So what does that mean? Less wait times. I just finished an annual physical here at the Cleveland Clinic down in Weston, Fort Lauderdale. And I go to their executive health program. I'm fortunate enough that I can afford that and I want to pay for that. And so when I go into the radiology waiting area to get my chest x-ray and there are 30 other people seated there, I go right in. I don't wait for 45 minutes. And I don't think anybody objects to that. No, they don't know why that happens necessarily, but the fact of the matter is that I paid for that privilege. I'm going to get the same quality of the scan. The person who's waited 45 minutes will get the same quality of the scan interpretation that I get. The only difference is that they've had to wait a little longer to get it. That's a matter of choice, right? That's a matter of consumer choice. So the point I'm making is that I can give you multiple examples of that, but the point I'm making is that I think healthcare providers, and by the way, the best illustration of this is what we talked about a moment ago, concierge medicine. So some providers are going, wait a minute, as long as we treat everybody the same way, we can serve them differently. And they've carved that out and said, well, there's a cohort that we've identified, and people can decide if they want to, pay the premium for that privilege or not. That's a matter of choice. We assert in the book that that is one of the fundamental principles that has been identified and refined in hospitality that has enabled them to maximize the financial performance of their service because people are prepared to pay for that privilege. So, and we know that's the case in concierge medicine where people pay a premium for that access. So anyway, that's a great question. And so the question is, well, how do you do that? Well, let's say it's not concierge medicine. Example would be, let's say somebody has to return to the same clinic once a month for, I don't know, whatever treatment it might be. Wouldn't it be better if you had maybe a different registration area for them where they don't have to stand behind 6 other people who may be first-time patients in the clinic who are going to get caught up in all the administrative requirements? And just that's a simple idea. So maybe you separate kind of registration areas where you have one that acknowledges returning patients and you have one that is for first-time patients, that kind of thing. The same would apply to preferential appointments. So access to preferential appointments. And this gets to be a little complicated, but I'll give you the example because I think it's very relevant. One of the other great revelations in service marketing has been the concept of variable demand and yield management. And the best illustration of that is you go online and you check an airfare today, and it might be different tomorrow. Right. And what's happened is the system has calculated the demand and said, well, we can sell these seats at this price and we're going to sell them at a different price tomorrow. You go on a website for a hotel and says, well, if you want to come Tuesday night, we're going to charge you this. If you want to come Friday night, we're going to charge you that. Right. So this whole concept of demand, variable pricing by demand doesn't exist in healthcare. We say, well, why not? I mean, shouldn't it? So if I'm a patient, if I say, the expression we use is in the airline business, we say, tell us what you want to pay and we'll tell you when you can fly. The same is true in the hotel business. Tell us what you want to pay, we'll tell you when you can come. And people go, oh, that's great, because maybe I really want to go on Friday night. I'm prepared to pay the premium, but then again, Tuesday's fine because I can save $100. Right? Well, the same scan that I'm going to get in radiology, I mean, the cost of that is pretty much fixed. Would it make sense to think about pricing some of these services in healthcare such that you provide patients with an opportunity to be served differently, as long as we treat them all the same way? Yeah, so there's someone who says, I don't want to wait 3 weeks for an appointment. I want an appointment next week. Okay, those are available, and what happens is you adjust the cost of the appointment accordingly. Now, people say, well, wait a minute, that's not fair. Well, I'm not sure what's not fair about that. If the treatment is consistent, regardless of how people seek it, but understanding that there are different cohorts of patients to be served differently. Now, that's controversial, and I acknowledge that, but we think it's inevitable in healthcare that it will go that way. Yeah, for reasons that I think hopefully I've articulated.